Scott Radomski. I'm the physical therapist. Well, I deal with all the aftercare. After Dr. Kassman does the surgery, I see him in the hospital, and then I follow the patients out to their house, working on getting them up and moving, walking, strengthening the leg, range of motion, teaching them everything they need to know as far as surviving at home. There's a process we have in place, there's expectations we have in place, but every patient's different. I mean, you can have 1,000 knee patients and they'll be different. You know, there's no cookbook, hey, do this, it'll work. We individualize it for each person. There's some people that come down that have a bad foot with a bad knee, or a bad back with a bad hip, you know, so you're always constantly working around things and modifying it for each individual. And that's what we do with our program. When they go home, we give them a lot of exercises, but we gear it towards some of their other issues too. So usually, like I said, they're in the hospital a day, maybe 2 days. Whenever they leave the hospital, I go out the next day to see them. We get them started on an exercise program. I give them a custom exercise booklet that I go through and we update it each time I see them. So usually they get about 3 visits worth of therapy. And by the end, it's just a matter of me formalizing, hey, this is what I want you to do when you're back home. You're good, you can go out and go to the gym, you can go follow up with therapy up there if you want to. You don't have to. You know, so a lot of times, they go home with a pretty comprehensive exercise program that they can just continue at their health club or even in their home, and it's fine. I think it's half and half. I think some people expect more, but I think a lot of them are shocked by how well they do. I think they really don't believe you until they see the results. I'll see a patient the day after surgery and say, hey, a week from now you'll be walking without anything. You'll be getting on your plane and going home. And they're like, there's no way, there's no way. A week after, they're like, man, you were right. You know, so a lot of times once they see how well it works and how well they do, they become believers pretty quick. And a lot of it is, it's a mental thing. You know, sometimes it just overwhelms them. They don't come in, they come in thinking, I'm not sure if I should do this. You got to be committed to it. You know, you have to, the best people that do well are people that come in and say, you know what, it's going to hurt, I'm ready to do this, let's get going. Give me my life back. Those are the ones that do well. I mean, in my years of doing this, have you had people that, yeah, and you can just tell. A lot of it is their persona. You know, oh, I can't do this. You can just tell the people that are going to struggle. They're not the people that are going to say, you know, I'm just going to meet it head on. I need to get through this, you know. So a lot of it is mental. Every patient, I mean, majority of them I see, the response is, I should have done this 10 years ago. I should have done this 15 years ago. I didn't know. My friend told me to be the worst thing. I didn't, you know. A lot of it is regret in a way that they waited so long.